sorry. You're good.
Libby, do you need a microphone?
I'll talk loud. Promise. Okay, so bear with me because I'm a little nervous, and so if I say something wrong and someone knows that I said it wrong, go ahead and correct me. But we're gonna go over adult CPR, infant CPR, and then choking. So first I wanted to go over our AED, which is in there if you haven't seen it. Am I talking loud enough? Mm-hmm. So we actually have adult pads and pediatric pads in here. The pediatric pads are a little bit smaller. And I double check them, make sure the date's correct, and I usually turn this on and make sure this is working. So if you're ever in the need of the AED, you can go and grab it. All you do is turn it on, connect the pad, and then you follow these instructions. It tells you exactly how to take it off, where to place it. And then as soon as you turn the AED on, it should give you instructions of when to stop compressions, when you should press the shock button, etc. So wanted to do that first.
When would you use that?
You could place it on any time whenever you're doing CPR. So if someone is unresponsive and you have to start CPR, you first need to start CPR and you need to delegate for someone else to go get the AED for you, because CPR is more important. Then you can put the AED on, and then it'll prompt you what to do after that. It'll read the rhythm, tell you if it needs to be, if they need to be shocked, and then tell you to continue CPR or pulse check.
How do you know you need to administer CPR when the person's laying down?
Yes. So CPR is needed when a person is unresponsive, not breathing, or only gasping. And gasping is kind of like an agonal breath. It's when someone is on the verge of cardiac arrest, they're not really breathing. And so first, you always want to check your surroundings, make sure it's safe to approach that person, and then you want to shout at them, see if they're okay. So you're going to go, "Are you okay? Are you okay?" and really shout at them. You're going to check their pulse, and then start CPR. You need to delegate 911 call and the AED. Now, of course, if you're the only one there, you can go ahead and call 911 and put them on speaker. But your main concern is starting CPR. So we're going to go over adults first. Any more questions before I continue? Okay, so adults, compression. So you're going to take the heel of your dominant hand, or up, it doesn't really matter. Place it at the center of their chest, the lower half of their sternum, kind of below the, right below the nipple line. You're going to interlock your fingers, and you kind of want to be above, so if you need it, sometimes we have a stool that we will stand on to make sure you're above, so you can use the rest of your body and not just your arms, because then you're too weak. It needs to be at 100 to 120 beats per minute, and then it needs to be at least 2 inches deep. And I'm going to have everyone come around and try this, because you'll see that it takes a lot of force. But this thing will turn green for the right rhythm and the right depth. You want to make sure that the chest completely recoils before actually going back down onto the chest. So for airway, you're going to tilt the chin up and back and kind of interlock it here. There we go. Up and back to open the airway. And you're going to this is going to be at least 1 second. You're going to do 2 breaths to 30 compressions. If for some reason you get tired and there's someone there to help you, it is better to go ahead and let someone else start CPR than continuing to do so, because the better the CPR, the better the chances. You're going to continue CPR until emergency personnel arrive, or if the AED tells you to stop and shock. If you don't have one of these handy, you can pinch the nose and go ahead and give breaths. But make sure you tilt the airway back to open the airway. Okay.
So it's how many compressions versus the breath?
30.
30 compressions, and
To
then you.
2 breaths.
Okay, and if you have 2 people helping, someone's doing.
Someone can do the compressions while someone does the breaths, and then you can interchange, and so that person can do the compressions, because it is tiring if you're just sitting there doing it for a long period of time.
So it's 30 compressions, and then how many breaths? 2? 2? Okay.
So then the infant, So with infant CPR, you're going to see if the infant is crying or coughing. If so, then you're going to continue to allow them to do so. But if they're unresponsive and unable to, whenever you're talking to them, if they're not crying back, you can go ahead and start compressions. You're going to check pulse again. This one, so they teach to do 2 fingers. Personally, it's hard for me to do 2 fingers. You can also do 2 thumbs. It's going to be right below the nipple line here. And then you can do a heel, but it's not as hard, or the heel of your hand, but it's not as hard as an adult. You're only going 1.5 inches on a baby, and you'll be able to feel that on both of these. So with an infant, it's still 100 to 120 beats per minute to every 2 breaths. You again want to allow the chest to come completely back up and then push back down.
That's the timing that you go off of?
What?
By the time the chest comes back up, you go right
Yes,
back
but you're
down?
going pretty fast. So it's
Okay.
120. So staying alive, staying alive.
All right, I was seeing if
That
that was
right
a
there.
joke or
There
not,
you
but
go.
you
No,
actually use
no,
that.
it's
Okay.
accurate. You can sing that in your head. It helps you with the beat.
Okay.
You're going to tilt the head back the same way. Make sure there's a good seal. When someone else can be doing this, and go ahead and squeezing. Now, for infants, if there's 2 people, you can do 15 compressions to 2. If there's only one of you, go ahead and do 30 to 2.
Where is it best to check the pulse on a baby?
On a baby.
Like this, where is it best to do the pulse? Is it like brachial, or, because I know it's hard to feel here.
Asks, I don't know. I don't know that answer. Does anyone know that answer?
It's the brachial.
It's the brachial.
Okay.
Which is where?
Yeah, where's the brachial?
Right here.
Sorry.
Oh, okay.
This is brachial.
Good question. Brachial.
And the same thing applies, you're gonna wanna delegate your 911 and your AED if possible. Do y'all wanna go over choking last and everyone come up here and try these? Or do you want me to go ahead and go over choking?
One of the questions, will you be able to know if you break a rib, and if you do, what do you do?
You keep going.
You just keep going.
Yeah, yeah. You're going to feel it.
You don't feel it?
You'll feel it.
Isn't there a danger of that broken rib and you
Yes.
continue going
Yes, but it's
into-
better to continue CPR than it is to continue CPR. That's proven, to continue CPR until medical personnel arrive.
What's the size difference where you'll change from infant method to adult method?
So infant is anything less than 1 adult method, but obviously you're not gonna go as hard and as deep on a child.
Right.
But it's still anything less than 1 is it?
Okay.
Now we're gonna go over choking. So if you think someone's choking, they usually cannot talk to you. They can't really cough, they can't really breathe. That means they're choking. So you can ask them, hey, are you choking? And if they're able to go, yeah, they still have some airway clearance and you need to encourage them to do it themselves. If they're unable to talk, cough, or breathe, then you're gonna stand behind the person and kind of cuff your hand like this with your thumb side just above the person's navel, and then use your other hand around them. And you're gonna do upward and inward thrusts until that object is expelled or the person becomes unresponsive. In that case, you would start CPR. Again, you would delegate 911. Hopefully someone's there. Now, of course, if no one's there, maybe you can call 911, put it on speaker, and go ahead and start. Now, for an infant, it's a little different. So, for an infant, if the baby's unable to cry or cough, then you need to go ahead and do. So, for an infant, if they are able to cough, you want to go ahead and encourage it. But if you can tell there's nothing coming, they can't cough, they're not crying, you're going to take them with your forearm and kind of support their head with your hand. And you're going to use the heel of your hand in between their shoulder blades. 5 thrusts, pretty hard ones. And you're going to check every time, but you're going to continue to do that if the object is expelled. Now after 5, you can spin, you're going to turn them around just like this. So it's kind of, it's easier to do so if you're sitting down. So if you can sit down, you can kind of put them on your knee, and then you can take your hand just like this and flip them over, and you're gonna do compressions on their chest, 5. You're gonna keep alternating until that object is expelled or the baby becomes unresponsive. Question?
What if you're at a restaurant and someone's choking on food,
Uh-huh.
and then like they're standing up? Would you just like push
Well,
them
with
up?
adults, they are going to be standing up usually. So you can go ahead and you take your thumb above their navel or their belly button, and you push inward and up. Inward up.
I have a question.
Yes.
On the age or the size,
This is infant. So child, it's typically, hold on, because I wrote it down. 'Cause I knew I was going to do it. This is infant. It's typically like 1 and younger, and then you do the rest.
yeah, so up to like 12 months, we could put them over.
Yes, ma'am.
And then after that, we would do them as an adult?
Yes, ma'am.
Okay.
So am I understanding that I wouldn't treat my boys, I'd treat them as adults if something was to happen?
Yes.
Okay.
Yes, yes, yes. Yes. Now, any other questions? Did I not say anything correctly?
It's perfect.
Okay.
Very good.
If you can see the objects in their throat.
There, you should not sweep. No, no, no. Do not
Okay.
sweep.
What do you mean by sweep it? You're.
Stick your hand in there because it'll just cause it to go
Push
down
it down
further.
in there.
Olivia, will you start off from the very beginning if you found that person
Do
laying?
you want me to
unconscious?
come in and do it?
Yes, ma'am.
That's, okay. Okay. Are you okay? Are you okay? I'm gonna check pulse, call 911 and get an AED. Okay. And then I'm gonna go ahead and start compressions.
Then, feel related. I want you to feel what it feels like.
I'll do it next. I'm not the relief yet. I panic in these situations.
And then I will get deep breaths.
I'm Mel's last safety.
So she can breathe.
Huh?
So you breathe?
Do the breathing. 5, 6, 7, 8, 15, 16, 17, 18, 19, 20, 21, 22, 23, 25, 26, 27, 28, 29, 30.
Do you check and see if they're breathing before you start compressions again?
Yes, you can. It's good to look at their rise and fall of their chest and to make sure that this is also accurate as well.
Okay.
Because you don't want to just, that's not gonna do anything. You want to go slow and watch the rise and fall. You can check for pulse again.
Where's the
then once you
best
get the
place to
AED
check
on-
for their pulse?
For their pulse is here.
On the neck?
And so, in a restaurant situation, we're not gonna have that, so you
No, so
actually.
you're going to have to pinch their nose.
And if you don't wanna do that.
And if you don't have
You can
to.
just go
Yeah.
straight to compress, like if they have
Because if
foam
you,
coming
if
out
for
of
some
their mouth
reason
like
it's
they will all
someone
the
that you
time.
don't know, or
Good.
you don't wanna contaminate yourself with something, you do not have to do that. Now, if it's your loved one or something, you
Yes.
probably will be doing it, but, yes.
One question, for someone like me who has neuropathy in our hands, I can't feel a pulse. What would it be best for me to just get somebody else, but what if I'm there alone?
It's better to start CPR. That's,
So just don't even try to check for a pulse?
yeah,
'cause
I mean,
can't
check and see
feel
if
it?
they're breathing, but it is better to start CPR than just wait, and it is the better thing to do.
When you say checking for a pulse, which is is it there, or are we looking for a certain beat per minute? Like, what are we looking for with pulse?
You're just looking.
It's there, okay.
Yeah, you still wanna, if you have an AED, get the AED on them, and
Cause that'll measure their heart rate.
it'll
plus-
tell you if it's a shockable rhythm or anything like that, if they can be shocked. And it'll tell you to step back, press the shock button, and then resume compressions. It should also tell you when to check for a pulse again and things like
Good. Essentially, 911 would also be able to give similar directions.
that. Right, so that's also good if there's someone there, or even if you're by yourself, just putting it on speakerphone.
Yeah.
Cause they can give you directions and walk you through it. Cause obviously, if you don't do it all the time, you're gonna be panicking.
Right.
And that would change if there was some other type of injury, right? Like if they stop breathing, but they've got like a severe injury where they're bleeding out, the pulse would be a lot harder, right? And that's something that you have to look for?
Yeah,
Because
let's
the
go.
heart's trying to make up for that blood loss, right? It's trying
Yeah.
to pump harder.
Yeah, it depends on if the person's, it depends on if it's an acute injury, like just happened, or if it's been there a while, then their pulse can become ready and weak.
So I know this is, about this right here, but, with choking, and I
Yes,
know
ma'am.
that in the body, we have actually had a situation where, baby passed because of a carrot. So maybe a young mother that might know some of the things that we need to cut in half.
Yes,
Like-
great. Honestly, anything that you think needs to be cut in half, you should just cut it in half. But even grapes, like people don't think grapes and blueberries they all need to be cut in half.
And carrots.
Yes.
Life-
Oh yeah, don't do that.
We almost lost Clinton on a lifesaver if it hadn't been for his nana, so.
I remember that.
Right.
I feel like something happened to us in Walmart. It's like Jacob.
Jacob choked on a Tootsie Roll Pop that came off the stick.
A Tootsie Roll Pop.
Mm.
And Alyssa choked on a lifesaver too.
Yeah. See?
Lily choked on a lifesaver in church, and Aunt Susie had to work on her.
Mm. So it would be carrots and grapes, and then there's some other, Tanya, do you remember, like a lot of the things that we were taught to cut in
Before
half?
a certain age, popcorn can get hung up easily in their throat. Pretty much anything, any kind of candy, bite it first.
Yeah, I don't. I wouldn't do any kind of candy, even if you think it's gonna melt.
And we're never to try to gag it or push it
No,
because it'll go
no, you do
down.
not, so that's sweep. You do not go and sweep it. If you see it, you encourage the baby, because if you can see it, most likely the baby is able to kind of, should get it out if you do some back thrust. But do not sweep, because it's just gonna push it further down. You might be able to get it, but you might not. Yeah. Okay.
Good.